Once again, another cardiovascular health conversation with Dr. Harvey White. Dr. White is a cardiologist, has started a new practice called Vessel Health in Albuquerque, New Mexico. He's founder and executive director, and this is a preventative practice. You want to see people before they have heart problems.
That's right, Larry. And listening to you makes me, reminds me that Vessel Health is a practice.
Yeah.
Vessel Health is a business. But Vessel Health is a reason to communicate. It's a reason to talk about these things. And I'm hoping that there's a Vessel Health in every city someday.
Yeah.
Because there is no real resource for people to go to who really want to prevent these issues.
Sure, and I think most thinking people understand that they've got to take care of their heart and they want to do the right thing. And we know a little bit about what we're supposed to do, but even talking with you, I don't know everything I probably need to know.
No, you haven't got the diploma yet.
No, I'm working on it though.
Yes, you're absolutely right. Some people are motivated in general. Others need to get scared. And one of the things that people are most scared about is stroke.
Yeah.
We talked a little bit about heart attack, and we talked about heart attack, where what creates it, and a little bit about what treats it. And if you had a moment, I'd like to talk about stroke.
Stroke is, as you said prior to this taping, not something you want to have. It's a very debilitating.
And some people would say, God, I'd rather have a heart attack than a stroke. Maybe neither, in all honesty. But I could tell you a little bit about stroke.
Okay.
If you want.
How does a stroke occur? What consists of a stroke?
Strokes are not all the same. Okay, I want you to recognize that to begin with. We divide stroke, which is a calamitous problem with the brain, into a couple types of strokes.
Okay.
One is a stroke in which there's bleeding in the brain, and that can happen in the context of things like high blood pressure.
Okay.
A more common type of stroke, though, is what we call ischemic stroke, where there's a blockage of blood flow to the brain, similar to the issues I showed you with the heart. The most common site of those is the carotid arteries. Do you know the carotid artery?
Okay, I think it's up here. Is it?
It's in the neck.
Okay, very good. I'm working on that diploma.
And for you, Larry, I drew a little schematic here.
There's our carotid.
This is the brain up here.
Okay.
This is the brain, and this is the carotid artery. It comes off the aorta, a big tube that comes out of the heart. And it gives blood supply to both sides of the brain in two carotid arteries. It has a common part, an internal part, and what's called an external part. The external carotid artery goes to the face.
Oh, okay.
Not an issue. The internal carotid artery goes to the brain. The carotid artery supplies blood to the brain, and it can become a problem not simply because of hemorrhage or bleeding, which I mentioned, but because it can become plugged up.
Okay.
And those plugs are two in type. One might be a plaque blockage, and we talked a little bit about a plaque blockage earlier and how they grow and so forth. Those plaque blockages can become so severe that they block this flow off, but also these plaque blockages are very fragile. They're junky, and they can give off little pieces of debris that travel up. And they call it an embolus. Moreover, Larry, just to kind of summarize here, you can also have an embolus come from your heart. And that would be one that starts much lower, but also travels up to the brain, sticks in a little blood vessel, and causes an infarction or death of that brain area.
So symptoms of a stroke are?
Symptoms of a stroke are dependent on where that blockage is.
It could be mild all the way to...
Absolutely. The worst strokes are those that occur if the blockage is deep in the brain.
Okay.
In the areas that we don't think about. Okay, they're the breathing areas of the brain where it's trigger our respiration, the area that triggers our heartbeat, etc. Those are often calamitous.
Right.
There are areas of the brain where strokes occur most commonly, and I mentioned how current flows in a stream. Those areas generally involve the part of the brain that controls muscle function, so that one could have paralysis or weakness of one side of the body.
Speech.
Or speech,
Yeah.
yes. Those are the most common, and they're usually one side or the other. The blood goes up blockage in one side,
Yeah.
other side.
And this is where it's infected.
That's correct.
How do you prevent stroke?
Stroke is extremely difficult to treat when it occurs, as opposed to a heart attack. Heart attacks, we have now developed some techniques.
Right.
And I've been involved in the past in trying to develop techniques to open the blood vessels that get blocked in the brain, but I can tell you it's extremely difficult. And its therapeutic value is limited. So stroke has to be something that is attended to before the fact.
Right.
Okay, which is we don't want any of this.
Can you test for this?
Yes, we can. And in fact, one of the things we do at Vessel Health is we try to understand whether or not an individual has atherosclerosis or blockages. And we're going to talk about how we do that. But one of the ways we do that in this instance is a carotid ultrasound. It's a Doppler, the same that we use to look at babies in mothers when they're pregnant. And we look for plaque as it's developed in the carotid artery. And I'll explain that in another session.
Very good. Somebody wants to know more about preventing a stroke, heart health. Where do they find you at Vessel Health?
Well, we'd love to have them call, and that's at 505-828-3000. Or they can seek us through our website, and that's at www.vesselnm.com.
Thank you.